Last week we heard about the food part of the top executives. You are all aware the performing top executives in industry, academia, or any position need to be nurtured properly in all respects. Today we will be discussing about holistic wellness, that is mental health of the top executives. Last week we discussed about their food uh, for the optimum performance. So these are the two very important aspects of total wellness of the executives. I will request Mr. Ganesh Iyer of Education, EduFuture to talk about this topic and introduce both the speakers. Though I have shared their biodata, I will request Ganesh Iyer to take over and start the topic.
Suprabhatam and Namaskar to all of you over there. Thank you, sir. Thanks for that introduction. Yes, in a very subtle manner, last time we did discuss about how food intake makes a very important impact on a happiness factor. Now, today we are in a continuation of that. We are talking about how mental health, in terms of a very holistic approach, keeps your mind happy and where you find peace and happiness amongst yourself. So today we have some two people. One is Swarupama Raskar, where her background coming from a medical anthropologist. She and I, we've been working with a lot of medical and different type of institutions where we find it is quite challenging to cope up with meeting the society requirements rather than their own happiness. I'm just putting it in one sentence. Then again, of course, we have Dr. Dhananjay Choudhary, a very dear friend of ours, who is a treating doctor himself, where he will give in more inputs. How exactly on a different kind of situations, how exactly you can keep yourself mentally fit and go forward, taking your life in a much meaningful purpose. Thank you, Swarupama, up to you and to Dr. Dhananjay Choudhary, please. Thank you very much.
Good morning to all, and happy Diwali to all of you from EduFuture Learning and myself. Today, as Dr. Ganesh and Vilas Rabde sir said, that we are discussing on mental health, but we would like to more focus on the holistic wellness of any professional. So, and we would like to have it in a preventive measure rather than going on a firefighting mode where the illness has taken a toll on the individual and that person has to now be treated through medication. So I'll just introduce about EduFuture. EduFuture Learning is basically into quality enhancement of education institutions. We assist the institution in achieving the highest level of quality delivery of teaching learning, and we help them in other statutory compliances also. And the second product which we have is the EduValley programs, which focuses on developing the skills of the faculties, the students, and overall the institution to cope up, to get into the new emerging technologies, be it research, innovation, and also we are helping industries also, because ultimately any institution, a person graduating, he will be the user or the product for a company or any institution which is like, we will call institution, because any institution is not only educational institution, but it is also a company or a small scale industry or any firm. So we are catering to majority of the stakeholders, and we would like to enhance their capabilities. And preventive health programs are also there, because in our experience we came to know that if you don't nurture the mind with a proper healthy individual, he or the productivity goes down. So we are also focusing on giving specialized programs for the rural and semi-rural sectors, and even IT sector and the top professionals, so that we are seeing for a healthy society also. So these are the main products. And coming to today's topic, holistic wellness, we are terming it as holistic wellness, but we are addressing mental health issues also in that, because in India, when you say mental health, still it is seen as a stigma, or they don't openly go and seek mental health. So we would like to term it as a holistic wellness for all the professionals. So now, why this topic we have taken, and why we are focusing on this? Because we want to have a holistic approach to wellness that integrates not only the mental, but the physical, social, occupational, and financial dimensions of a professional in the modern work. Because anybody who is working, he has to have a sound physic, a sound financial background, and a peace at home, so that he can work uh, productively at the given place. And now, in this connection, we have been seeing that after the pandemic, it has become very what to say, it has become very first priority of every individual to also take care of their mental health and social well-being. But there are many issues which are casting a shadow on their overall well-being. So today we are going to address them. And as you know that in India, the tradition of yoga and Ayurveda is prevalent. And through the Indian knowledge system, we can integrate this with the modern medicine and give a spiritual dimension to it also, and a comprehensive well-being can be achieved with this. After the pandemic, there is a burnout issue, and job burning out is a all-time high in 2025, as the survey suggests that 66% of global employees are experiencing burnout in some or the other format. It might not be pinpointed, but the major causes are like the long hours, which contributes to 58%, whereas, sorry, 58% of the burnout issues, and heavy workload and work-life balance imbalance is also a major contributing factor in it. So these are the major factors, and other factors are merely 2% of it. So mental health issues cost the global economy more than 1 trillion every year. So if you see, it is a silent killer of the today's epidemic. uh, when you see there is poor mental health, it is not only being absent from the work, but there are other foreseen activities also, like it is a financial burden for presentism also. Even if a person is present in office, but he is only physically present, and there are many things going on in his mind when he is at the work, but his productivity is almost zero. And these type of things are much more than just absenteeism. So the underlying causes are many: the anxiety, depression, stress, and other work related stigma, and it is also preventing them from seeking help, or just having the Google doctors, which can worsen the symptoms, and then they can have more issues. And this in turn is also causing the industry to face financial losses because of unproductivity. So it is high time that the industries start taking the cognizance of this and implement measures. So now when you say that flexible hybrid work, this has also caused a new dimension in the health scenarios. Everybody is trying to juggle between their home and the work, and where the line of differentiation between the house and the office is diminishing. There are many struggles they are facing. They cannot disengage themselves from work and get engaged also, because when we were having that 9 to 5 job, or say 9 to or 10 job also they were having, like 10 p.m. But they were in the office, they could work properly over there, and when they are retiring home or returning home, there was a transition period. But now this line has diminished. So there are many things which are affecting them, and there is the different techno stress which is leading to high blood pressure and emotional issues and anxiety also. Dr. Dhyanraj will explain more in detail how they are going to cope and things. But these are the things which are there underlying over there, and we need to address them. So there are 5 dimensions as we have defined. We would like to take care of the mental and emotional well-being or the wellness, the physical wellness, the social wellness, and occupational wellness, and financial wellness, because these things are interlinked. They are not separate. You cannot compartmentalize them. So, as I said, we have to have holistic well-being as a mandate, and we have to give solutions to the industry. So EduFuture is working on that, and we would like to also create awareness among people, like what is actually mental health, and what are the symptoms, or what can be the signals, and how you can take measures at the right time, so that will not cost any individual more harm than going to at the last stage of any illness. So I will just like to end over here and give the presentation to Dr. Dhyanraj, who will explain more in detail about what are the illnesses and what it is. Dhyanraj sir, you can, I will share the slide for him.
Yes, madam.
Yeah.
So at the outset, good morning to all and happy Deepavali to all. I would like to thank Iyer sir, Swarupama madam, and all the Tech Forum members for giving this opportunity to share my views on this very interesting topic about the holistic approach towards mental health. So my name is Dr. Nyanraj Choudhary. I am a practicing psychiatrist in Baner. I am pass out from BJ Medical College, Sassoon Hospital. Though I am a psychiatrist, I am a treating doctor. I will try not to speak much about medications and biological things in the psychiatry, but to cover the holistic things about the mental health. So I would start with psychiatry is basically a branch of medicine. Lot of people has confusion between psychiatrist and psychologist. So we psychiatrists are basically medical doctors, and this is a specialized degree after MBBS, like medicine, surgery, gynec, and other branches are there. So this is a specific specialized branch in mental health, and we practice psychiatry after MBBS. Completing MBBS, there is a 3 years post graduation in psychiatry. Okay, so what is mental health? So basically, mental health involves emotional, psychological, and social well-being. So mental health issues can affect how we think, feel, and act. So this is the famous triad: thought, emotion, and behavior. That is thinking, feeling is emotion, and action is behavior. So this triad usually is applicable everywhere in all psychological disorders. So we go by this triad only: thought, emotion, and behavior, that is thinking, feeling, and action. It perhaps also determines how we deal with stress, relate to others, and make choices in the life. So if a same situation is given to 10 different people purposely, you can expect 10 different outcomes because you are dealing with 10 different personalities altogether. So that is how the reaction would be different with different people, because there are a lot of factors which are involved in that. Next slide, madam. Okay, so talking about the incidence of mental health issues. So roughly the prevalence means the number of cases in a given particular period at that point of time of any disorder is the prevalence. So prevalence of mental health problem in general population is 1 in 4. which means roughly 25% of people are affected with some minor or major mental health issue. So in short word, you can start suspecting every fourth person sitting next to you to have some kind of mental health disturbance in general. The range is huge. Like we see patients or cases from very minimum stress related issues to the other extreme, that is severe extreme, who are unmanageable and very violent, exhibit very violent behavior, and they need IPD care, that is inpatient care, and all further medical and biological management. So what does it exactly mean? So we will be discussing two aspects of it. Preventive aspect, like there are so many treatment modalities which are available in market now, which will speak about the preventive aspect, how to prevent uh, some mental health issues, which is like little difficult. And my specialty is about how to treat the mental health issues when it actually occurs. Okay, so holistic approach usually describes mind, body, and spirit as a single unit, which are not independent of each other. It is a complementary treatment method which can or should only be used in addition to the proven conventional biological method, which is scientifically proven and which is usually the medical management, that is use of medicines. Now, there is a big misconception in the society that the psychiatric medications are usually addictive. Secondly, once the medications are started, one cannot stop the medicines. Then regarding the side effects, there are so many misconceptions in the society. But usually, in my experience, majority of the medicines are very, very safe and they rarely cause any major side effect when it is monitored properly. So in my experience, usually I am practicing since last 17, 18 years and few patients are there with me since that time only, and they are very, very healthy, maintaining improvement without any side effects. So these medicines are usually very, very safe. Next one. Okay, so these are the available holistic treatment options. Medications you will not see in this because I am considering medications as the first line and all these are the second line. So meditation, yoga, acupuncture, aromatherapy, herbal remedies, massage therapy, nutritional therapy, and faith healing also. Faith healing is an important part, especially in the Indian scenario, where till date, before coming to psychiatrists, most of the almost 90% of the people have usually seen some faith healer before going to the psychiatrist. In addition to this, there are so many other treatment modalities which are available in the market, but the evidence with those is very, very limited. So I have not listed those in that. So out of all these treatment modalities which are available, the list which I have shown before this slide, there are so many things like past life regression is there, people who are practicing. 6 months back, there was a patient who was admitted because he wanted to talk to his dead girlfriend. And he was so much deluded and obsessed with that that he was seeking help from the professionals. I only came to know that time only there are professionals who are helping people to talk to the dead people. So there are so many things available in the market, but the evidence with that is very, very limited. So what actually works amongst this? Of course, medicines, the biological management, which we are doing, undoubtedly works very well. Then counseling and psychotherapies. The second very important part, counseling is like just ventilation. You can talk, talk, talk. You will feel better because you are venting out your emotions. Psychotherapy is little different from counseling. It is more structured, organized, and here both the therapist as well as the client has to take the active participation in planning and taking the psychotherapy sessions further. So it is more organized way of counseling than counseling. And there are so many tasks which are given to the client in psychotherapeutic sessions. Then simple relaxation techniques. The one which we commonly suggest to our patients is Jacobson's progressive muscle relaxation. So basically, it is a physical activity, but supposed to give the mental relaxation. You can Google it. It is the most scientific way of doing the relaxation. Jacobson's manual. Then simple breathing exercises like what in Ayurveda is called as Anulom and Vilom. Then basic lifestyle modifications, say no to drugs, drug-free lifestyle. So this is very, very important point. So any mind altering substance, maybe it is nicotine, alcohol, or other things which are available in any form, in any quantity, is definitely not healthy for anyone. So though people say ki for socialization we need to have alcohol, or for socialization we should smoke, uh, by smoking we feel good. It is true, nicotine is known to have some anti-anxiety effect, but that is the very minimum effect of nicotine. But other the dangerous side effects which nicotine has are way more than that anti-anxiety effect. So health, what basically health means? So WHO has defined health as, WHO has clearly mentioned that health is not absence of disease. So WHO says it is complete physical, mental, and social well-being, and not merely absence of disease or infirmity. So WHO is saying it is okay to fall ill, because health is not absence of disease or infirmity. So maybe it is physical health or mental health. It is okay not to be okay. So when it something is wrong with body, we call it as physical illnesses. When it is something wrong with your mind, thoughts, or emotions, we call it as psychological illnesses. So the main point is what can be or should be treated and how is the choice. That depends on the individual completely. So as I said in previous slides, still today till date, people are going to the faith healers. So uh, masjids, dargahs, temples, or pandits and maulanas, they will visit them first to seek the help. This is more very common in rural areas. Still, it is there in urban areas also. And then they will come to the psychiatrist for the help. So awareness is still lacking about the mental health issues in the society. So now this concept of normalcy to abnormalcy. So this normalcy is basically a spectrum which is monitored and guided by multiple factors. So, few minutes back only, as I said, ki if 10 people are exposed to similar situation, you can expect 10 different outcomes, because there are 10 different personalities which are exposed to the same situation. So the 10 different reactions can be expected. Again, there are social and cultural norms for the said behavior. As I said, ki 10 people exposed to same situation, from which social background, from which cultural background they are coming, that also will determine their behavior. Their upbringing, childhood traumas, family dynamics, relational status between the family members, everything is important. Then their peer group, friends, and later on work culture. When they start working, work culture also plays an important role. Everything gets accumulated together in one's behavior, which is counter checked by ego and superego. So these are the defense mechanisms all of us are having. If we do something that is permitted by our ego, so whether it is right or wrong, that is decided afterwards. But ego will control those things, and when ego will make mistake, there is a higher authority called as superego, which is there to control the ego. So this id, ego, and superego. Id is very basic. Ego is little mature. Superego is most mature. This is the structure of mind given by famous psychiatrist Mr. Sigmund Freud, Dr. Sigmund Freud. Finally, what determines one's behavior in given situation is all the mixture of all above things like social, cultural background, personality, family, genetic. Uh, what we are because of our parents only, because we imbibe personality traits from our parents directly. Peer support system, peer friends, everything. All this together will determine one's behavior in given situation. Next, man. Yeah. Similarly, to mental health also, from health to illness, the same spectrum concept applies here also, uh, which is made universal with the help of uniform diagnostic criteria, guidelines, rating scales, which are again standardized, standardized clinical interviews and assessment. So it's not because I feel someone is having depression, one should be suffering from depression. So when someone is coming to me for assessment, I will be using some standard rating scales or standard clinical assessment procedures to diagnose someone, and then only I will come to some conclusion. After coming to conclusion, I will decide what to start, whether to start treatment or not. So it's a long procedure. Finally, standard and universally accepted treatment guidelines and algorithms are also available. We follow some principles, fixed protocols. Suppose the diagnosis is made X. So what are the standard guidelines available for treating the problem X? We follow that only. Next slide. Okay. So lastly, the only solution that are ever worth anything are the solutions that people find themselves. This is said by Satyajit Ray. So whatever we say, I say, or anybody says, we have to find solutions by ourselves only. There are so many people who will guide you, misguide you, confuse you in the society. But at the end, you have to be your own mentor, and you should be there to find your own solutions. Thank you so much.
Yeah, it was a wonderful presentation.
Yeah.
I'll request Dr. Ganesh Iyer to conclude, then we can start the question and answer. Let him have the comments.
Yes, yes.
Thank you, sir. Thanks to Dr. Choudhary, and thanks to Swarupama. Now, coming from what both the people did mention about, we also are looking into, as Swarupama did mention in part of a discussion, also from the professional perspective. She spoke about one particular activity, what is called as the productivity. We also are talking to medical institutions, and I would really like to and happy to say a very dear friend of ours, Dr. Manish Khatri from Delhi, is also part of the audience. Thank you, doctor, for coming over. So we have been discussing a lot in terms of medical holistic mental health. And as Dr. Choudhary did mention, we speak about performance and how exactly a performance is understood. Like, for example, what happens is when I'll just take institutions, since we deal with a lot of medical science institutions, and Dr. Khatri will surely add value, or he may agree or disagree with me. That's a different part. After having said this, what happens is when we look from Indian medical science institutions, the management has certain responsibilities, the faculties have certain responsibilities, and at the same time, when we talk about the coming up doctors whom we're talking now, we're talking about all the, we are churning up doctors right, left, and center. But when we look into the medical perspective, are we looking into a patient getting treated successfully? Are we looking into the profit perspective? I'm just taking this particular example from mental health view, because today the doctors also are equally highly stressed, especially if they're working in corporate hospitals. They're also equally highly stressed, because since it's a corporate hospital, they have targets to meet, which I will not get into too much of details into it. So in fact, I'm sure Dr. Choudhary also would be knowing this from his perspective. Yes, there are huge chances where the doctors themselves are highly stressed to meet the targets. So when this happens, how exactly are the patients being treated? Like, there always is a discussion. It takes 30 minutes for a patient to get admitted. But when the same patient has to be discharged, it takes hours together, days together. So why is it happening? Are we talking about a complete restructuring of the processes in a hospital? Or what exactly is mattering that a patient, he or she being treated, what's happening? So this is a huge kind of a debate that has been happening. So hence, we are also talking about mental health from an institution perspective, where we also are talking to students. We are telling the students, out of every students we come across, how many of them really want to become a doctor? If yes, why? There are a lot of things that we've been discussing about. So hence, along with the collaboration of EduFuture, along with collaboration with Samayat, which Dr. Choudhary represents, we are planning to come out with a capacity building activity exclusively for IT sector and for the manufacturing segment, in assessing one, in terms of the capacity building, capacity activities of any organization. At the same time, also understand the health perspective. Hence, we, as Swarupama did mention, we are using this nomenclature holistic health rather than talking about the mental health. So this particular part, this holistic health, is something which I would really personally like to thank Dr. Choudhary and Swarupama Raskar of coining this nomenclature rather than going forward and telling we look into our mental health. So a lot of work needs to be done. There are a lot of wonderful people here in part of the team who are contributing, who also needs to contribute what exactly, let us say in future 5 to 10 years, how exactly the society is going to happen. So this is what I would say. And yes, it's open for questions, it's open for suggestion, open for different perspective and views from the participants, which sure Dr. Choudhary and Swarupama will surely answer that. Please continue.
Yeah. Thank you, Dr. Ganesh. Thank you. I think in this regard, we will appreciate Dr. Khatri's comments in this, because he is expert in this line from New Delhi. So, Dr. Khatri, would you like to share?
Definitely, sir. Like as such, I am a dentist by profession, and I'm attached to a dental college. Also, I'm the vice principal of the college, and say I'm into teaching for the last 24 years, I would say. Yes, when I had a word with Dr. Ganesh, so he was interested in talking about oral health also related to these things, but I think we will plan it in the future webinars because today it was quite a short notice for me. Definitely, sir, what you have talked about is quite relevant, and the remedies also. And my daughter being pursuing MBBS, I have seen like the kids also nowadays. She has a batch of 250, and most of them are having some types of, I think, pressures on their mind, or the expectations from the parents are so much. Living up to those expectations, all of them have certain issues with their mental health. And moreover, like Dr. Ganesh pointed it out, we working in any institute or a private setup or a corporate hospital, yes, definitely we have targets.
Yes,
Say,
yes.
hospitals have targets about the patients. We have targets about, first of all, would be student admissions, then their passing outs and all those things. And the competitions are so much, you have to prove yourself in whatever field you are. So definitely the mental health is being affected. And as you pointed out, the overall WHO also, the health as such per se, it has to be an overall health of an individual, which uh, myself being a dentist and especially a specialist of the gums, which we call as a periodontist, uh, I am into research quite a lot. So oral health also affects the general body health. So if I get an opportunity, say a few weeks down the line, I would be talking about those things.
Definitely,
And
sir, we would like to invite you, because see, now we are looking out from the efficient executive, and he should be taken care. Like we have taken two topics. First is the food. Second is the mental health or holistic health. Third could be the oral. There may be few more angles to this. Definitely, Tech Forum would like to cover these angles, because this is something different that we have taken up this topic, and it is more relevant and useful in today's scenario, because the executives are stressed to the optimum level, and they need to fight and come out with the amicable solution or right solution. So definitely oral health we can take up whenever you feel time. November we have two slots available. We can take one of the slot for oral health also. Thank you, Dr. Khatri.
right,
uh
sir, right.
yeah,
Definitely, I
so
will do
you
that.
can we will talk to Ganesh and fix up your presentation also.
Sure, sir. Sure,
Yeah.
sure,
Now
sir.
we will make this floor open for question and answer. First, identify yourself and then fire the question. Over to the audience.
Hello,
Yeah. Word, Vijay.
doctor. My name is Vijay Ghate. I put my remark in the chat. Our experience so far here is no one does psychotherapy and such preventive methods. Everybody goes for, all psychiatrists go for medication to begin with. We don't even know whom to approach if for the first interaction. Is my observation right? as a general rule?
Sir,
No, sir.
yes, doctor will also answer, and after he finishes, I will also answer the question.
Yeah. So I would not completely agree with that, sir. We have around 7 psychologists who are working with us. So it is a teamwork. So basically, I am working in a tertiary center where patients are referred from different psychiatrists. So they definitely need medications because till they come to me, they are already landed into the chronicity of the illness. So they definitely need medicines. Psychotherapy is always as a supporting will play always the supporting part. Once the patient settles down with the medicine, as you know ki this treatment is usually long term and they have problems with the inside, they don't feel that they are ill and they should continue the medicines. That is where psychotherapy plays role. Like psychotherapy, there are so many subtypes of psychotherapy which are designed for different disorders. So yes, we do have 7 psychologists who are working specifically dedicatedly for psychotherapeutic interventions only.
Okay, thank you very much, doctor.
Yeah, thank you, sir.
Hello.
Yeah, please.
Yes, sir.
Hello. My name is Anil Chaitanya. From the Tech Forum. The forum is usually representing all type of professionals in various fields. The typical things we observed that when psychology or health become an acute or very high level, then we reach to the doctor or professionals reach to the doctor. But most of the major 95-98% portion of the professionals, they observe internally themselves and keep doing working. So in this case, do you have any basic guidelines or simple tips to all of us, all of the professionals, that we should take care while working in our regular routine working or various type of stress? I would like to hear on that.
Yeah, yes, sir. So this for this na there are very basic simple tricks ki healthy lifestyle, good amount of sleep, and no addiction. These are the 3 tips I would give, which can fairly lead to a very good, healthy, normal life. All these are the risk factor: reduced amount of sleep, presence of addiction. These are all bad prognostic factors according to the our psychiatric this thing. So presence of this factor will make the things worse definitely.
Hey, thank
And
you. And I have a
nutrition also plays very important role in this.
exactly. I was about to talk on this. I just would like to ask one more follow-up question to this. The mental stress and physical stress, are they hands in hands? For example, when you are really high level in a physical stress, mental stress is become a lesser or equivalent or ignorance or something like that. For example, why I'm asking these questions, because couple of times my friends or colleagues or in your proficiency people tell, if you are feeling stressful, go and take a bath, or go and make a jogging, or go and play a table tennis or something like that, which is a physical stress activity. So is there any
Right.
relation between mental stress and physical stress, helping each
Yes, sir,
other or
definitely.
advisory?
So they go hand in hand, like you all professionals or even me. I'm not physically fatigued anytime because my job is just to sit in the chair and talk to the patients. That's it. But that doesn't mean I'm not stressed out because I'm mentally so much taking toll. I'm absorbing so much negativity of my patients day in day out. So that is definitely affecting me mentally also. So this mental fatigue and physical fatigue usually go hand in hand. At the end of the day, I am also fatigued, though I'm not doing any great physical activity.
Okay, okay. Good. Thank you, doctor.
One question is there from my side. I'm Dr. Nilima Kulkarni from Modern College of Engineering. So here you have told us that this mental health depends upon various factors. But I want to ask one basic question. Is it depend on DNA or genetic structure of that person?
Yes, madam. Generally, mental health issues or mental health disorders have a multifactorial etiology. You cannot just pinpoint one thing and say ki this person is having this problem because of this particular thing only. So genetically also there is a high chance if the one of the parents or both of the parents or cross genetics in the first degree relation is someone is having some mental health issue, the chances compared to normal population are more that the individual will have some problem. This is one factor. Other is the individual's own personality, which will determine how he will react in the given situation. Because as you said, two people might react differently. Even I said that 10 people could react differently when they are exposed to the similar situation. So biology, personality, and social environmental factors. These are the three factors which will determine altogether ki how the person will react in given particular situation, and the chances of having the mental illness also depends on these three main factors only.
I'm Shashi Gangal. I'm a retired professor. Uh, it's true that a person should have a calm and strong mind. And I feel that it can be inculcated right from the childhood. Do you have any suggestions for the parents for changing, upcoming, upgrading or upcoming child, to grow the child in a proper fashion?
Yeah, madam. Your point is completely right, because all the young age people who are coming to us, we usually have noticed that the problem is in the parents only. Either family is nuclear, there is nobody to take care. Secondly, both the parents are working in most of the cases. Thirdly, one of the parent is having addiction issue, mostly the father,
Yeah.
male in the family is having the addiction. So these are all the things which children model. They grow
Yes.
up looking at their parents only, then their friends and society in general, and they will keep taking all the things in. Still, they are growing. They are immature.
Yeah.
They
Yeah.
don't know what
I'm
is
I'm
right
worried
and what
about
is wrong.
I'm worried about them.
Yeah, madam. So this parental counseling is very important, and yes, we are doing it in the practice regularly.
Good. It was a very
Thank
interactive
you.
session today. I really appreciate both the speakers as well as the audience. And Ganesh, thank you very much for organizing this.